Do you suffer from major depression? Do you have a history of traumatic brain injury? How about a history of cancer, autoimmunity, or heart disease? If you have any of these things, omega-3 fatty acids, also known as fish oils, could be a huge piece to helping you reach optimal in your case. Let's dive into all that omega-3s have to offer, and everything I'm going to say in this video is backed up by research. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Why are fish oils or omega-3 fatty acids beneficial to our health? Why are they necessary? Well, they're necessary because they are essential fatty acids, meaning our body cannot make them on its own. So we must get them from diet or from outside sources. This is why fish oil is so important. Fish oil is the best source of omega-3 fatty acids in our diet. Other lesser sources are flaxseed oil, certain nuts, and grass-fed meats. But fish oil, especially small fish like herring, sardines, mackerel, are the best source because they're lowest in the food chain. They accumulate the least amount of toxins and heavy metals in our oceans, and they're easy to harvest, and it's ecologically sustainable to harvest them. So why are fish oils important? Because they are anti-inflammatory. If we think about chronic disease in our society today, we can look at it like this. Heart disease, cancer, autoimmune disease are the three main hitters. Well, two other things that people are commonly affected with are major depressive disorder, and everyone's worried about aging. How can I anti-age? So if you're aging too fast, fish oil can be anti-aging for you. Well, why? All of these things have as a part of them pro-inflammatory cytokines, which is a fancy word for molecules or chemicals, like interleukin 1, interleukin 6, platelet activating factor, and on and on and on. These things are all opposed by fish oils or omega-3s, which are anti-inflammatory. If you have arthritis, Crohn's disease, ulcerative colitis, MS, all of these are autoimmune, and these have been shown to be opposed by fish oil. So the benefits of fish oil are multiple. One, anti-inflammatory. Omega-3 fatty acids are anti-inflammatory, whereas omega-6 fatty acids are pro-inflammatory. Omega-6 are found in high amounts in our grains, in our dairy, and all of our processed foods. The average American ratio of omega-6 to omega-3 is 40:1. Evolutionarily or historically, the hunter-gatherer ratio is from 4:1 to 1:1. So Americans are very, very inflamed, and hence the massive increase of pro-inflammatory diseases like heart disease and cancer and autoimmune diseases in the last 100 years in our society. So fish oil comes in because fish oil is anti-inflammatory because of its omega-3 to omega-6 ratio benefits. It raises that omega-3 side. Fish oil is anti-clotting because it suppresses thromboxane function and fibrinogen. Fish oil is anti-autoimmune, as we said, because it inhibits certain inflammatory cytokines and promotes immune balance. And recent studies have shown that fish oil combined with vitamin D and multiple sclerosis shows significant benefits. Fish oil decreases oxidative stress, so it can be seen as an antioxidant. Fish oil decreases triglycerides. So if you have insulin resistance, metabolic syndrome, or diabetes, fish oil is very helpful in decreasing triglycerides, promoting HDL, decreasing insulin, and just switching that whole metabolic profile towards one that is promoting of health instead of disease. Fish oil is anti-aging. It has been shown to lengthen telomeres or prevent the shortening of telomeres. Telomeres are like the little caps on our DNA. If you picture your shoestring as your DNA and the tape at the end that lets you feed it through the holes as the telomere, that's the telomere of your DNA. If that shortens, as that shortens, you age, and when it shortens too much, your DNA can no longer be reproduced or copied effectively, and we die. So fish oil is anti-aging in that way. Fish oil has been shown to prevent Alzheimer's. The earlier that you take fish oil, the lower your risk of Alzheimer's, especially in people who are susceptible to Alzheimer's that have the ApoE4 genotype. Fish oil is massively useful as an antidepressant in major depressive disorder. EPA, the EPA fraction of fish oil, is the majorly anti-inflammatory side systemically. DHA is very, very important for brain and decreasing brain inflammation and neuron function. Fish oil promotes brain-derived neurotrophic factor, or BDNF. BDNF promotes healthy synapses, or talking of the nerves to each other in the brain. So neuron to neuron passing the signals that we need to think, to move, etc. Fish oil inhibits or has anti-infectious properties because it helps promote immune resolution of inflammation, whether that's caused from trauma or infection. Fish oil helps promote a healthy blood-brain barrier. So if you've had a head injury, it helps heal that barrier. And if you bonk your head, if you have sufficient fish oil levels pre-injury, it helps decrease or lessen the amount of damage from the injury. Fish oil promotes healthy full-term pregnancy. Studies have shown that mothers with suboptimal fish oil levels are at higher risk of preterm birth. So brain development in utero requires fish oil for optimal brain development, and then once the baby is born, throughout childhood, fish oil is very important for brain development. This is why the baby preferentially gets whatever omega-3s the mother has through the breast milk, and that's one mechanism of postpartum depression, is if the mother went into pregnancy deficient and breastfeeds and baby gets whatever low level she has, that drives her more deficient and more prone for depression. So fish oil is key pre-birth, prenatally, and throughout life. So if you have a question as to whether or not fish oil is beneficial and necessary and essential in your supplemental armament, the question is yes. And then to dial in what is right for you, that's where you have to meet with a functional practitioner who can look under your hood and understand your whole web of physiology and make recommendations in terms of when you should take it, how much, and for how long.